Have you ever considered that a persistent itch in a specific spot on your body could be more than just a minor annoyance? Perhaps a quiet warning from your body about something as serious as cancer? For most people, a little itch here or there is easy to dismiss as dry skin, an irritation, or a passing issue. But for older adults, especially those over 60, itchiness in very particular areas might be a signal that demands attention, a message from your body that you cannot afford to ignore. Unlike random itches that come and go, these are distinct patterns often linked to serious conditions like lymphoma, pancreatic cancer, breast cancer, or skin cancer, sometimes appearing months before more obvious symptoms like pain or lumps. This comprehensive guide uncovers 5 specific places on the body where persistent itching could indicate cancer, offering you the knowledge to recognize these signs, understand their deeper causes, and take action before a condition progresses. We'll explore not just where these itches occur, but why they happen, which cancers they're associated with, and how to distinguish a harmless skin issue from a potential red flag, empowering you with the tools to know what to watch, for what questions to ask your doctor, and when to seek answers. Stay with us until the end, as we'll provide practical steps to act on these insights, ensuring you're equipped to listen to your body's whispers before they become shouts. This isn't about living in fear or jumping to worst-case scenarios. It's about paying attention, trusting your instincts, and understanding that early awareness can make all the difference in catching something treatable before it becomes harder to manage. Let's begin with the first sign: persistent itching on the lower legs, a symptom that might seem like a minor nuisance, but could be a critical clue, especially for older adults. When itchiness develops on the shins or calves, particularly without a visible rash, dryness, or any obvious trigger like new soap lotion or bug bites, it's tempting to chalk it up to aging skin, a common issue as we grow older and our skin loses moisture. However, this specific relentless itch, one that lingers for weeks, often worsens at night, and refuses to respond to moisturizers, has been quietly observed in many individuals later diagnosed with blood-related cancers, particularly lymphomas like Hodgkin's or non-Hodgkin's lymphoma. Unlike the occasional itch that a bit of cream soothes, this sensation feels deep, almost burning, as if it's coming from beneath the skin, even when the surface looks perfectly normal. The reason lies in how these cancers affect the lymphatic system, a vital network of vessels and nodes that helps regulate the body's immune response and fluid balance. As lymphoma cells multiply, they release inflammatory chemicals known as cytokines into the bloodstream, which can irritate nerve endings, especially in the lower limbs, where blood flow may already be slower in older adults. This irritation triggers a persistent nagging itch that no amount of scratching or lotion can relieve, a signal that something deeper is amiss. Take George, a 75-year-old retiree who shared his story at a cancer awareness event, describing how his only symptom for nearly 6 months was an uncontrollable itch on the front of his legs, particularly intense at night, disrupting his sleep and leaving him frustrated. His primary care doctor initially suspected eczema or a detergent allergy, prescribing creams that did nothing. It wasn't until blood tests revealed abnormal white blood cell levels, followed by scans showing swollen lymph nodes in his chest, that the diagnosis of lymphoma became clear, with the itch as the earliest clue, long before weight loss or night sweats appeared. Stories like George's are not uncommon, highlighting why this symptom deserves attention, especially when paired with other subtle signs like unexplained fatigue, night sweats, or weight loss. For older adults, the body's distress signals become less obvious with age. Pain may be absent, lumps may be too deep to feel, but the nerves remain sensitive, often expressing internal changes through itching. If you or a loved one has been scratching their lower legs nightly, applying creams with no relief, and wondering why nothing works, don't dismiss it as just aging. Schedule a doctor's visit, request blood work, and describe the pattern in detail. Its persistence, its resistance to treatment, its timing, because sometimes the smallest symptoms carry the biggest messages, and listening could lead to early detection. Moving to the second sign, itching between the shoulder blades or upper back is another specific area that's often overlooked, easily blamed on dry air, poor posture, or an irritating shirt tag. But for older adults, a persistent itch in this exact spot could be an early warning of pancreatic cancer, a condition notorious for its subtle onset. This itch is unique. It feels deep, almost as if it's coming from under the skin, and it can appear months before more recognizable symptoms like abdominal pain, jaundice, or digestive issues. The connection might seem puzzling. How does an organ deep in the abdomen cause itching in the upper back? The answer lies in the pancreas's role in producing bile, a digestive fluid that flows through bile ducts to the intestines. When a pancreatic tumor grows, it can obstruct these ducts, slowing or stopping bile drainage, leading to a buildup of bile salts in the bloodstream. These excess bile salts irritate nerve endings, particularly in areas like the upper back, where a dense network of sensory nerves makes the skin highly responsive. The result is a nagging, unrelenting itch that no lotion back scratcher or change in bedding can alleviate. Linda, a 70-year-old grandmother, experienced what she called a phantom itch between her shoulder blades, waking her every night as she tried to scratch a sensation that felt internal, untouchable. She tried everything: moisturizers, a new mattress, even acupuncture, but the itch persisted. During a routine checkup for unrelated fatigue, her blood work showed elevated liver enzymes, prompting imaging scans that revealed a small tumor in her pancreas, pressing on the bile duct. That itch was her only symptom for months, with no pain or yellowing skin, and her decision to mention it to her doctor led to early detection, giving her a fighting chance. This is why the upper back matters. While general back itchiness might stem from dryness or friction, a focused, persistent itch that resists treatment, especially if accompanied by darker urine, pale stools, or unexplained tiredness, could point to an internal issue. For older adults, dismissing such symptoms is common. We hesitate to make a fuss over something as seemingly trivial as an itch. But your body is wiser than you think, sending signals that deserve to be heard. If this insight resonates, comment number 2 below to let us know you're with us, and subscribe with the notification bell on to stay updated with more life-saving content. Your support helps us continue this vital work. The third sign, an itchy scalp without visible flakes or dandruff, might seem like a minor annoyance, often attributed to dry air, aging skin, or an ill-suited shampoo. But when it's persistent and resistant to treatment, it could signal something deeper, including blood-related cancers like leukemia or skin cancers affecting the scalp. Unlike typical scalp itchiness caused by dandruff or sensitivity, this sensation feels different, more like a tingling, crawling, or burning under the skin, sometimes moving from one spot to another, and it doesn't respond to anti-dandruff shampoos, moisturizing oils, or other remedies. For older adults over 60, this could indicate nerve irritation triggered by abnormal immune activity, as seen in leukemia, where multiplying cancer cells disrupt the body's inflammatory balance, sending signals to the skin's nerves. Henry, a 73-year-old retired teacher, noticed his scalp itching every afternoon, a sensation he initially blamed on his shampoo, then his favorite baseball cap. He switched products, went hat-free, and tried medicated treatments, but the itch remained, growing more intense over weeks. During a routine blood panel for fatigue, his doctor discovered abnormally high white blood cell counts, leading to a bone marrow biopsy that confirmed early-stage chronic lymphocytic leukemia, with the scalp itch as his only early symptom. A 2022 article in Blood Advances, the Journal of the American Society of Hematology, reported that 20% of leukemia patients reported persistent itching or skin sensitivity before diagnosis, particularly in older adults. This case underscores why an itchy scalp shouldn't be ignored, especially when it's persistent and unaccompanied by visible signs like flakes or redness. Skin cancers such as basal cell carcinoma or melanoma can also begin as an itchy patch on the scalp, particularly in areas with thinning hair exposed to years of sun damage, often appearing as a small bump or dry spot that itches relentlessly. Because the scalp is hard to examine on your own, enlist a spouse, caregiver, or hairdresser to check for unusual patches, discoloration, or bumps, and seek a dermatologist's evaluation if the itch persists for weeks without relief. For older adults who often deal with dry skin or sensitivity, it's easy to normalize such symptoms, but a resistant itch that lingers, especially with fatigue, bruising, or feeling off, warrants investigation. The fourth sign, localized itching on the chest or breast area, is particularly significant as it's often mistaken for irritation from clothing sweat or aging skin. But persistent itching in this region, especially around the nipple or beneath the breast, could indicate inflammatory breast cancer or other tumors near the chest wall. According to the National Cancer Institute, inflammatory breast cancer accounts for 1% of all breast cancer cases, and itching or skin irritation is often one of the first symptoms reported, sometimes even before a lump is detected. This itch is distinctive. It's focused often in one spot and may feel warm, tight, or irritated, sometimes accompanied by subtle skin changes like roughness, thickening, or a reddish tint, though it can also occur without visible signs. For women and occasionally men, this symptom can precede the discovery of a lump, making it a critical early clue. Ruth, a 69-year-old retiree, noticed an odd itching sensation around her right breast, which she initially attributed to her bra's underwire. She switched detergents, tried looser clothing, and even went braless, but the itch returned daily, always in the same spot. At a checkup, her doctor noticed slight skin dimpling and ordered imaging revealing a small aggressive tumor near the skin surface, not the typical round lump she'd expected. Inflammatory breast cancer is particularly dangerous because it doesn't always follow the classic cancer playbook. It can mimic a rash, spread quickly, and often presents with irritation rather than pain. For men, male breast cancer, though rare, can also manifest as an itchy patch near the nipple or thickened skin, easily missed because men rarely associate breast tissue with cancer risk. Itching in this area can also stem from enlarged lymph nodes under the arms or collarbone, signaling lymphoma or another malignancy, especially if accompanied by swelling, warmth, or a heavy feeling. If the itch is persistent, localized, and unresponsive to creams, particularly with skin changes or vague discomfort, don't delay. See a doctor and request imaging or a biopsy. Comment number 4 below if this resonates, and subscribe to support more content like this. The fifth sign, persistent itching in the anal or genital area, is one of the most uncomfortable and often ignored symptoms, yet it can be a critical warning of anal, vulvar, or penile cancer. This itch is frequently mistaken for hygiene issues, infections, or irritation from clothing or incontinence products, but when it's chronic, burning, or raw and persists despite treatment, it demands attention. Eugene, a 76-year-old widower, dealt with what he thought was hemorrhoid irritation for nearly a year, trying creams, dietary changes, and compresses, but the itching never fully subsided. A colorectal specialist's scope exam revealed a small lesion in the anal canal, an early-stage tumor that could have grown silently without his persistence in seeking answers. For women, vulvar cancer, more common after 60, often begins with a recurring itch on the outer genital area, sometimes with rough, discolored, or thinner skin, mistaken for postmenopausal dryness. This area's high density of nerve endings makes it a sensitive signal for internal changes, whether from skin cell mutations, nerve inflammation, or lymph node involvement. Hesitation due to embarrassment often delays diagnosis, but speaking up about a persistent itch, especially if it's unilateral or worsening at night, could lead to early detection. If this symptom feels familiar, consult a healthcare provider. Don't let discomfort silence you. In reflecting on these 5 areas, lower legs, upper back, scalp, chest, and genital region, it's clear that persistent itching isn't just a surface issue, but a potential message from your body, especially for older adults. These signs linked to cancers like lymphoma, pancreatic, breast, or anal cancer often appear before more obvious symptoms, offering a window for early action. This isn't Have you ever paused to consider that a persistent itch in a specific spot on your body might be more than just a fleeting irritation? Perhaps a quiet signal from your body hinting at something as serious as cancer. It's all too easy to dismiss a little itch as a trivial issue, dry skin, a new detergent, or a minor allergy. But for older adults, particularly those over 60, itchiness in very specific areas could be a critical warning, a message from your body that demands your attention before it's too late. According to the American Academy of Dermatology, chronic itching lasting longer than 6 weeks affects approximately 15% of people over 65, and in some cases, it may be an early symptom of an underlying cancer, especially blood-related cancers like lymphoma. Unlike the random fleeting itches we all experience, these are distinct, persistent patterns that medical professionals have repeatedly observed in patients later diagnosed with serious conditions such as lymphoma, pancreatic cancer, breast cancer, skin cancer, or even anal and genital cancers. These itches often appear months before more obvious symptoms like pain lumps or weight loss, serving as an early alarm that could save your life if heeded. This comprehensive guide delves into 5 specific places on the body where persistent itching could indicate cancer, equipping you with the knowledge to recognize these subtle signs, understand their underlying causes, and take proactive steps to protect your health. We'll go beyond simply listing body parts, exploring why these areas itch, which cancers they're linked to, and how to differentiate a harmless skin issue from a potential red flag that warrants further investigation. By the end, you'll know what to watch for, what questions to ask your doctor, and how to act if one of these signs feels familiar, empowering you to advocate for your health with confidence. Stay with us until the end, as we'll provide practical advice to turn awareness into action, ensuring you're prepared to listen to your body's whispers before they escalate into shouts. This isn't about stoking fear or assuming every itch is a crisis. It's about cultivating awareness, trusting your instincts, and recognizing that early detection can dramatically improve outcomes for even the most serious conditions. Let's begin with the first sign: persistent itching on the lower legs, a symptom that might seem like a minor annoyance, but could be a vital clue, especially for older adults navigating the complexities of aging bodies. When itchiness develops on the shins or calves, particularly without a visible rash, dryness, or any obvious trigger, like a new soap lotion bug bite or clothing change, it's tempting to attribute it to aging skin, a common issue as the years advance and skin loses its natural moisture and elasticity. However, this specific type of itch, one that lingers for weeks, often intensifies at night, disrupting sleep, and resists relief from moisturizers or anti-itch creams, has been quietly noted in many individuals later diagnosed with blood-related cancers, particularly lymphomas such as Hodgkin's or non-Hodgkin's lymphoma. Studies published by the Lymphoma Research Foundation report that up to 30% of patients with Hodgkin's lymphoma experience persistent, unexplained itching as an early symptom, often months before other signs appear. Unlike the occasional itch that a dab of lotion soothes, this sensation feels deep, almost burning or prickling, as if it originates beneath the skin's surface, even when the legs appear perfectly normal to the naked eye. The reason lies in the lymphatic system, a crucial network of vessels and nodes that regulates the body's immune response and fluid balance, acting like a drainage system for toxins and waste. In lymphomas, cancer cells multiply within this system, releasing inflammatory chemicals called cytokines into the bloodstream, which can irritate nerve endings, especially in the lower limbs, where circulation may already be sluggish in older adults due to reduced activity or vascular changes. This irritation manifests as a relentless, nagging itch that no amount of scratching, moisturizing, or environmental adjustment can alleviate, serving as a subtle but persistent signal that something deeper is wrong. Consider George, a 75-year-old retired mechanic who shared his story at a local cancer awareness event, recounting how his only symptom for nearly 6 months was an uncontrollable itch on the front of his legs, particularly intense at night, leaving him tossing and turning as he tried to find relief. He initially thought it was dry skin from the winter air, then suspected his laundry detergent, and his primary care doctor prescribed eczema creams that proved useless. It wasn't until routine blood tests prompted by mild fatigue revealed abnormal white blood cell levels, followed by imaging scans showing swollen lymph nodes in his chest, that the diagnosis of lymphoma became clear with the leg itch as the earliest, most persistent clue, long before night sweats or weight loss emerge. Stories like George's are not rare, underscoring why this symptom deserves serious attention, especially when accompanied by other subtle signs like unexplained tiredness, night sweats, or unintended weight loss, which can be easy to dismiss as just getting older. For older adults, the body's distress signals become less overt. With age, pain may be absent, lumps may be too deep to feel, and traditional symptoms may not manifest until a condition is advanced, but the nerves remain highly sensitive, often expressing internal changes through itching as a first line of communication. If you or a loved one has been scratching their lower legs nightly, applying creams with no relief, and wondering why nothing seems to work, don't write it off as an inevitable part of aging. Schedule a visit with your doctor, request comprehensive blood work, and describe the itch in detail, its persistence, its resistance to treatment, its timing, and any accompanying symptoms. Because sometimes the smallest, most stubborn symptoms carry the weightiest messages, and acting on them could lead to early detection and a better chance at effective treatment. Moving to the second sign, itching between the shoulder blades or upper back is another specific area that's often overlooked, easily attributed to dry air, poor posture, an old mattress, or an irritating clothing tag. But for older adults, a persistent itch in this precise spot could be an early warning of pancreatic cancer, a condition notorious for its insidious onset and subtle initial symptoms. According to the Pancreatic Cancer Action Network, this itching can appear in 1 in 10 cases of pancreatic cancer, usually as a result of bile duct obstruction from early tumors long before abdominal pain or jaundice is noticed. This itch is distinctive. It feels deep, almost as if it's emanating from beneath the skin, and it can emerge months before more recognizable signs like abdominal pain, jaundice, digestive issues, or weight loss, making it a critical early clue for those who notice it. The connection might seem puzzling at first. How does an organ buried deep in the abdomen, behind the stomach, cause itching in the upper back, far from its location? The answer lies in the pancreas's role in producing bile, a digestive fluid that flows through bile ducts to the intestines to aid in fat digestion. When a pancreatic tumor grows, even a small one, it can obstruct these ducts, slowing or halting bile drainage, leading to an accumulation of bile salts in the bloodstream. These excess bile salts circulate and irritate nerve endings, particularly in areas like the upper back, where a dense network of sensory nerves makes the skin highly responsive to internal changes. The result is a nagging, unrelenting itch that resists lotions, back scratchers, or changes in bedding, often waking the person at night as they try to relieve a sensation that feels frustratingly out of reach. Linda, a 70-year-old grandmother and avid gardener, experienced what she described as a phantom itch between her shoulder blades, a sensation so persistent it disrupted her sleep, prompting her to try moisturizers, new pillows, and even acupuncture, all to no avail. She described it as feeling inside her body untouchable by any external remedy. During a routine checkup for unrelated fatigue, her blood work revealed elevated liver enzymes, a finding that led to imaging scans and the discovery of a small tumor in her pancreas, pressing on the bile duct with the itch as her only symptom for months long before pain or yellowing skin appeared. Her decision to mention the itch to her doctor, despite feeling it was a minor complaint, led to early detection, giving her a fighting chance against a notoriously aggressive cancer. This is why the upper back is significant, while general back itchiness might stem from dryness, allergies, or friction from clothing. A focused, persistent itch that resists all treatment, especially if paired with darker urine. Pale stools, unexplained fatigue, or a vague sense of unease could point to an internal issue that needs urgent attention. For older adults, dismissing such symptoms is all too common. We're conditioned to avoid making a fuss over something as seemingly trivial as an itch, or we attribute it to the wear and tear of aging. But your body is wiser than you might think, sending signals that deserve to be heard even if they seem small. If this insight resonates with you, comment number 2 below to let us know you're following along, and subscribe with the notification bell on to stay updated with more life-saving content. Your support helps us continue this vital mission to inform and empower. The third sign, an itchy scalp without visible flakes or dandruff, might seem like a minor inconvenience, often blamed on dry air, aging skin, an ill-suited shampoo, or seasonal changes. But when it's persistent, resistant to treatment, and feels more like a tingling, crawling, or burning sensation, it could signal something far more serious, including blood-related cancers like leukemia or skin cancers affecting the scalp. Unlike typical scalp itchiness caused by dandruff, psoriasis, or sensitivity to hair products, this sensation is distinct. It moves from one spot to another, feels deep rather than surface level, and doesn't respond to anti-dandruff shampoos, moisturizing oils, or other standard remedies, leaving the person frustrated and puzzled. For older adults over 60, this could indicate nerve irritation triggered by abnormal immune activity, as seen in leukemia, where multiplying cancer cells disrupt the body's inflammatory balance, sending erratic signals to the skin's nerves, particularly in the scalp, which is rich in nerve endings. Henry, a 73-year-old retired schoolteacher, noticed his scalp itching every afternoon, a sensation he initially attributed to his new shampoo, then to his favorite baseball cap, which he wore daily while walking his dog. He switched products, went hat-free, and tried medicated scalp treatments recommended by his pharmacist, but the itch persisted, growing more intense over weeks, sometimes feeling like a burning tingle that kept him awake. During a routine blood panel prompted by mild fatigue and occasional bruising, his doctor discovered abnormally high white blood cell counts, leading to a bone marrow biopsy that confirmed early-stage chronic lymphocytic leukemia, with the scalp itch as his only early symptom, a clue that might have been missed without his persistence in seeking answers. This case highlights why an itchy scalp shouldn't be dismissed, especially when it's unaccompanied by visible signs like flakes, redness, or scaling, and persists despite all efforts to treat it. Skin cancers such as basal cell carcinoma or melanoma can also manifest as an itchy patch on the scalp, particularly in areas with thinning hair exposed to decades of sun damage, often appearing as a small bump, dry spot, or scaly patch that itches relentlessly, sometimes bleeding with scratching. Because the scalp is difficult to examine on your own, especially with hair coverage, enlist a spouse, caregiver, hairdresser, or friend to check for unusual patches, discoloration, bumps, or sores, and seek a dermatologist's evaluation if the itch persists for weeks without relief, particularly if paired with fatigue, easy bruising, or a general sense of being off. For older adults who often deal with dry skin sensitivity or age-related changes, it's easy to normalize such symptoms, assuming they're just part of getting older. But a resistant itch that lingers and defies treatment is a signal that warrants investigation, as it could be the body's way of flagging a deeper issue before more obvious symptoms emerge. The fourth sign, localized itching on the chest or breast area, is particularly significant as it's often mistaken for irritation from clothing, sweat-tight bras, or aging skin. But persistent itching in this region, especially around the nipple or beneath the breast, could indicate inflammatory breast cancer or other tumors near the chest wall, a critical clue that's frequently overlooked. This itch is distinctive. It's focused, often confined to one specific spot, and may feel warm, tight, or irritated, sometimes accompanied by subtle skin changes like roughness, thickening, a reddish or orange peel-like texture, or slight dimpling, though it can also occur without any visible signs, making it easy to dismiss. For women and occasionally men, this symptom can precede the discovery of a palpable lump, making it a vital early warning that could lead to life-saving intervention. Ruth, a 69-year-old retired librarian, noticed an odd itching sensation around her right breast, which she initially attributed to her bra's underwire digging into her skin. She switched to softer bras, changed detergents, and even went braless for days, thinking it was friction or sensitivity, but the itch returned daily, always in the same spot, growing more intense over weeks. At a routine checkup, her doctor noticed slight skin dimpling near the itchy area and ordered a mammogram and ultrasound, revealing a small aggressive tumor near the skin surface, not the typical round lump she'd been taught to expect in breast cancer screenings. Inflammatory breast cancer is particularly dangerous because it doesn't always follow the classic cancer playbook. It can mimic a skin rash, spread rapidly, and often presents with irritation or warmth rather than pain, making early detection challenging. For men, male breast cancer, though rare, can also manifest as an itchy patch near the nipple, a small area of thickened skin, or a persistent twinge under the chest muscle, symptoms that are often ignored because men rarely associate breast tissue with cancer risk, especially in their 60s, 70s, or 80s. Itching in this area can also stem from enlarged lymph nodes under the arms or near the collarbone, signaling lymphoma or another malignancy, particularly if accompanied by swelling, warmth, or a vague sense of heaviness in the chest. If the itch is persistent, localized, and unresponsive to creams or lifestyle changes, especially with skin changes, warmth, or discomfort, don't delay. Consult a doctor and request imaging, a biopsy, or a referral to a specialist to rule out serious causes. If this symptom resonates with you, comment number 4 below to share your thoughts, and subscribe to support more content like this, as your engagement helps us reach others who need this knowledge. The fifth and final sign, persistent itching in the anal or genital area, is one of the most uncomfortable, often ignored, and socially sensitive symptoms. Yet it can be a critical warning of anal, vulvar, or penile cancer conditions that are rare but more common in older adults. This itch is frequently mistaken for hygiene issues, yeast infections, irritation from clothing, incontinence products, or hemorrhoids. But when it's chronic, raw, or burning and persists despite diligent treatment, it demands serious attention, as it could be the body's way of signaling a developing malignancy. Data from the American Society of Colon and Rectal Surgeons shows that anal cancer is more common in individuals over 60, and persistent anal itching, pruritus ani, is one of the most frequently overlooked early signs, particularly in men. Eugene, a 76-year-old widower and retired carpenter, dealt with what he believed was hemorrhoid irritation for nearly a year, trying over-the-counter creams, dietary changes to soften his stools, and cold compresses to ease the discomfort. But the itching in his anal area never fully subsided, returning with a burning intensity that disrupted his daily life. Frustrated and concerned, he consulted a colorectal specialist who performed a scope exam and discovered a small lesion in the anal canal, an early-stage tumor that could have grown silently and spread without his persistence in seeking answers beyond self-treatment. For women, vulvar cancer, which becomes more prevalent after age 60, often begins with a recurring itch on or near the outer genital area, sometimes accompanied by rough, discolored, or thinner skin symptoms that are easily mistaken for postmenopausal dryness, hormonal changes, or minor irritation. The anal and genital regions are rich in nerve endings, making them highly sensitive to internal changes, whether from skin cell mutations, nerve inflammation caused by cancer growth, or swelling in nearby lymph nodes, which can trigger itching as an early response. What makes this itch particularly concerning is its ability to disguise itself as something benign. People assume it's a reaction to toilet paper friction from walking or a side effect of hygiene products, and in many cases it might be. But when it lingers for weeks or months, worsens at night, or feels more raw than surface level, it's a red flag that deserves investigation. Eugene's story and others like it highlight why hesitation, often due to embarrassment or fear of seeming overly dramatic, can delay diagnosis, allowing a treatable condition to progress. Speaking up about a persistent itch, especially if it's unilateral, focused in one spot, or accompanied by subtle changes, like skin thickening or discomfort, could lead to early detection and significantly better outcomes. If this symptom feels familiar, don't let discomfort or stigma silence you. Consult a healthcare provider, whether a primary care doctor, gynecologist, or colorectal specialist, and insist on a thorough examination, which may include a biopsy or imaging to rule out serious causes. In reflecting on these 5 areas, lower legs, upper back, scalp, chest, and genital region, it's evident that persistent itching is far more than a surface-level nuisance. It's a potential message from your body, especially for older adults whose symptoms may be subtler and less predictable. The CDC and American Cancer Society emphasize that early detection increases survival rates for many cancers by 70–90%, yet over 40% of older adults ignore initial symptoms, often dismissing them as part of aging. These specific itches linked to cancers like lymphoma, pancreatic, breast, skin, anal, or vulvar cancer often appear long before more obvious signs like lumps, pain, or systemic symptoms, offering a critical window for early intervention. This guide isn't about fostering fear or suggesting that every itch is a crisis. It's about empowering you to trust your instincts. Notice unusual patterns and advocate for your health with confidence. If any of these itches resonate with you or a loved one, don't brush them off as nothing or assume they're just part of aging. Schedule a doctor's appointment, describe the details when it started, how it feels, what you've tried, and push for tests like blood work, imaging, or a specialist referral if needed. Your body is always communicating, sometimes through pain or fatigue, but often through something as subtle as an itch that won't quit, and listening to those signals could mean the difference between catching a condition early and letting it silently grow. Share one thing you've learned from this guide in the comments below, whether it's a new awareness of your body's signals, a step you'll take to check a persistent itch, or a story of how you've advocated for your health. Your insights inspire us to keep creating content that informs and empowers. If this guide has been valuable, please like, subscribe, and share it with others who might benefit, as your support helps us continue this vital mission to spread life-saving knowledge. Thank you for joining us on this journey to better understand your body's messages, and we look forward to connecting with you again in the next video. Not out fear, but empowerment, trusting your instincts, noticing patterns, and advocating for yourself. If any of these itches resonate, don't brush them off. Talk to your doctor, describe the details, and push for tests if needed. Share one thing you've learned in the comments below, and let us know how you'll use this knowledge. Your insights inspire us. Like, subscribe, and share to spread this vital information. Thank you for joining us, and we'll see you in the next video.